Hey YouTube, Rick Wilson here. This is not a normal video. This is a public service announcement. With the coronavirus going on, the president just spoke on TV. I didn't think he looked good myself. He was actually serious for a change, but I think it was more because he didn't feel good. It was what it looked like to me. But that's not the point. That's not the point of the video. They're saying the biggest problem that's coming is ventilators. The country does not have enough ventilators for the number of people that's going to be sick here in about a month. And we've got 100,000 ventilators and they need 200,000. And all the scientists are saying we need to get ventilators, but there's no way they're going to come up with that many ventilators. So I got to doing a little research, and I found an article that's in the Library of Congress that somebody done some research on, can you supply more than one patient with one ventilator? Is that possible to put two patients on one ventilator? And this study is actually done by a government agency. It's in the Library of Congress. It's on the internet if you want to look it up. It's right here behind me. I'm going to disappear and let you be able to read it, but I'm going to keep talking. A single ventilator for multiple simulated patients to meet disaster surge. That's the article, and it says they did a study to see if they could run in an emergency situation. Could an emergency department run more than one person on one ventilator? And they said they used lung simulators to simulate people, and they use available plastic tubing that is already in the hospital and ventilators. They used an 840 series ventilator, Puritan Bennett human lung simulator. People were added to the ventilator in parallel. So you just take the tubes out and parallel the tubes to each patient, and till the ventilator was ventilating the equivalent of 4 adults. Data was collected including peak pressure, positive and expiratory pressure, total tidal volume, and total minute ventilation. So the medical people will know what that means. I got a little bit of an idea, but medical people will know what that means. Any obvious asymmetry in the delivery of gas to the lung simulator was also documented. The ventilator was run for 12 consecutive hours, and that was 5.5 hours of pressure control and more than 6 hours of volume control with this breathing with the patients. The results: using readily available plastic tubing set up to minimize dead space volume, the 4 lung simulators were easily vented for 12 hours using one ventilator. And in pressure control set at 25 millimeter H2O, the mean tidal volume was 1,884, approximately 471 milliliters per lung simulator, with an average peak pressure of 28 cm of H2O, and the minute ventilation was 32.5. So anyway, if you know anybody in the medical field that needs this information, if your hospital, if they understand, look this article up, that they can hook more than one person up per ventilator, it might save some people. Okay, and this article is in the Library of Congress, and it's on the internet. If you just type in a single ventilator for multiple patients, this article pops up right here, right behind. So, see y'all later. I hope we help somebody. And if you know anybody, got a nurse in the family, doctor, tell them about this. Let them know, so they know, just so they know. You know, I found this study was done a while back. It's been buried. A lot of people don't know about it. It was just for an emergency, you know. So now's the emergency, and here's a solution to part of the problem. See y'all later.